Hello, everyone. This is Jennifer Salazar with the Better Business Bureau Education Foundation in Houston, Texas. Thank you all so much for joining us today. Welcome to fall, everyone. The month of October will be devoted to information on Medicare open enrollment periods and Medicare open enrollment scams. The BBB Education Foundation Scam of the Week for October 5th, 2020 is the basics of Medicare open enrollment. Everyone needs to be ready for the Medicare open enrollment period. It begins October 15th and runs through December 7th. Medicare open enrollment is prime time for fraud. Now, in today's presentation, we're going to talk about the very basics because when you think about it, it's like building a house. We have to start with the frame. So yes, we will not be discussing the actual scams today. We're going to talk about the very basics of Medicare open enrollment. Now, next week, we'll start getting into the scams. But first, let's talk about what the Senior Medicare Patrol is. We are a federally funded program. There's one in every single state in the United States, including Guam, Puerto Rico, the Virgin Islands, and Washington, D.C. That is a total of 54. We recruit and train volunteers and professionals about Medicare fraud and abuse. If possible fraud or abuse is to occur, we report that to the Medicare control units. In the great state of Texas, the Better Business Bureau Education Foundation of Houston has the honor of having the Senior Medicare Patrol grant. We have a fabulous volunteer program, and we even have ways for you to volunteer right now during the coronavirus that keeps you safe. We also do outreaches across our whole great state, all 254 counties. And if fraud or abuse is to occur, you can always call us at the Texas Senior Medicare Patrol at 888-341-6187. Now, let's talk about the very basics of Medicare open enrollment. Let's start with the 4 parts of Medicare. You have Medicare Part A, which is your hospital insurance. Medicare Part B, which is your medical insurance. These 2 parts of Medicare, A and B, is known as Original Medicare. Then you have Medicare Part C, which is a Medicare Advantage plan. They're a lot like HMOs and PPOs. Now, they include Part A and Part B, and sometimes a Part D plan. But if you're on a Medicare Advantage plan, it's no longer Original Medicare. You're now on a specific plan. And then you have Medicare Part D, the prescription drug coverage of Medicare. Let's focus on Medicare Part D, the prescription drug program. Now, this is offered by private insurance companies. The coverage varies, including drugs covered, copay amounts, deductibles, and gap coverage. Beneficiaries are encouraged to compare plans prior to enrolling. Medicare Part D and a Medicare supplemental insurance. Beneficiaries in Original Medicare, which is Medicare A and B, also have the option of purchasing additional insurance to cover gaps in coverage. Now, Medicare Part D helps cover the cost of prescription drugs and is run by private insurance companies that follow set rules by Medicare. That's just for prescriptions. Now, your Medicare supplemental insurance, commonly known as Medigap, is not a part of Medicare. It is also offered by private insurance companies. And this helps with your Medicare A and B, what's left over. It helps cover those gaps. Now we're into Medicare Part C, known as Medicare Part Choice, Medicare Advantage plans. These are also offered by private insurance companies. They must provide all Medicare A and B benefits. Many offer benefits that Original Medicare A and B doesn't cover. Most also include a Medicare Part D plan. And there are 5 main types of a Medicare Advantage plan. What we want you all to know is you are in control right now. It is important that you review your Medicare Part D plans and your Medicare Advantage plans, if you have one, every single year, because plans change and you want to make sure that your prescriptions and your doctors, for those of you that are in Advantage plans, are still in your network. If you would like to enroll in a plan, we encourage you to shop and compare plans by calling 1-800-MEDICARE. That number is 1-800-633-4227, or by visiting www.medicare.gov. Get a family member to help you if you don't know how to use the internet, or call the SHIP, that's the State Health Insurance Assistance Program. In the great state of Texas, those are run by the Area Agency on Aging, and you can speak to a qualified benefits counselor at the Area Agency on Aging. And to reach them anywhere in the state, their phone number is 1-800-252-9240. Please tune in next week. Next week, we will cover scams to watch out for during Medicare open enrollment. Today, we wanted to give you the basics. It's like building a house. We wanted to give you the framework. And then next week, we're going to start building the house by telling you the scams to watch out for. Thank you all so much for joining me today. Again, my name is Jennifer Salazar with the Houston Better Business Bureau Education Foundation. I'm also the State Director of the Texas Senior Medicare Patrol. If you need to report Medicare fraud, error, or abuse, please contact us at 888-341-6187. You can always reach me directly at 713-341-6184. Or you can email me at jsalazar@bbbhou.org. Thank you and stay safe.